Now, an NHS doctor has revealed a Covid-19 patient deliberately coughed in his face because she was tired of waiting to be seen. Dr. Mohammed Abbas Khaki has decided to speak out about the incident in the hope that people will stop abusing frontline staff. Well, I'm pleased to say that he joins me now. Dr. Khaki, welcome to the show. This must have been absolutely horrific, first of all, mustn't it?
Yeah, it was a horrendous experience, really. I mean, in 2020, all we've been talking about is COVID-19 and the importance of looking after yourself and looking after each other. And I just couldn't believe anyone would do that. You know, we know this is the most deadly virus of our lifetime, and to try to deliberately infect somebody else, it just beggars belief, and it's such a terrible thing to happen. It was a shock, if I'm honest. I couldn't believe anyone actually do that.
I should say the Met Police are investigating and no arrests have been made so far. I mean, you had to isolate at home then afterwards for a while. I think that's over now, isn't it? Yeah,
that's right. Yeah, I mean, obviously we spoke to the microbiology team and got the advice to find out, you know, what we needed to do, and spoke to the police, raised the incident, and started to make some amendments to how we look at patients, because, you know, the incident was such that, you know, a lady walked past, saw that I'd taken off my PPE, taken off my mask, and actually pulled off her own mask, pulled it away and coughed towards my face in a deliberate act. And that sort of thing is something that we shouldn't be facing really from the front line. It's something that actually thousands of my colleagues are seeing around the country. And it was something that I felt that 2020 is a watershed moment for us. And it's time for us to really look at how we protect the people who are protecting us. And if I don't speak up, nobody necessarily may feel they can speak up. So I said, look, let me talk about this issue and let's raise awareness of what's happening.
Mm. And this woman, I mean, she came back, didn't she, later on, I think?
Yeah, so when she did it, I was in a state of shock. You know, I just couldn't believe it. Did someone cough at me? And then the realization this patient had COVID-19. And as all of that was playing out, the security guard had seen the incident. He said, oh, look, and he called her and he went to get her. She tried to leave and say she didn't do it, but then she came back and said, look, you know, there's no evidence I didn't do the thing you're sort of accusing me of. And then he pointed at the security cameras, which showed the incident, and she immediately realised she'd been caught, and she quickly made an escape and got in her car and drove away.
I didn't ask it. Did you test positive or negative after you've been tested?
Well, we didn't test in the end, because the advice from the microbiology team has been that if I develop symptoms, then I should be tested. But until that happens, we don't need to be tested. So just a case of quarantining for that period of time.
Of course, it is.
Thankfully, yeah.
There's the shock of not knowing. I mean, there are fewer COVID patients around, thank goodness, aren't there? But you want to see, obviously, more safeguards to prevent things like this.
Yeah, I think, you know, this speaks really to society in general, and a case of how we respect one another and how we are looking after those frontline workers who are working so hard, wherever they may be. This is something that we've seen from nurses, we've seen it from pharmacists, doctors now, and also, you know, other frontline workers. And really, enough's enough. Assault like this can't be tolerated. We have to have a zero tolerance policy, and really think about how we are putting in safeguards to protect people who are working hard to protect us and this country at this critical time.
Because we've seen it with other frontline staff as well, haven't we, over the last few months?
We have, yes. We know about the tragic case of one of the frontline rail staff passing away, suspected to be related to this. And, you know, that's something that is unfathomable. It's just, you can't understand why anybody would want to do this to anyone else at this time. It's such a nasty assault. And I have to say, you know, the majority of patients have been unbelievably grateful. So thankful for the amount of effort we're putting in, and always reciprocate with thanks and gratitude. And I do think, you know, these cases are not the majority, they're the small minority, but one case is more than enough. You know, one case should be a case for us to say, actually, we can't allow this to happen. You know, this is a deadly virus that we're dealing with. and we can't go around coughing on other people, trying to infect other people. This sort of assault needs to be stamped out. Really.
Absolutely. Sounds horrendous. Thank you so much for talking to us about it. Dr. Khaki there. Thank you so much.